I had a patient recently, let's call him Harold, a composite of patients I see regularly. 52, otherwise well, and he'd been trying to lose weight on and off for about 20 years. He'd done the diets, done the gym, lost weight, he'd put it back on, he'd lost it again, he'd put it back on again. And he sat in front of me and said, "Doctor, is there anything left that I haven't tried?" As it happens, there is now. I'm Dr. Michael. I quite literally and accidentally fell into medicine, and despite trying to leave many times, I am a family doctor with almost 30 years in clinical practice. On this channel, we don't just list symptoms and prescriptions, we slow down and ask the less obvious questions that change real medical decisions. Welcome to The Accidental Doctor, where we discuss uncommon sense medicine. Now, are you trying to lose weight? Shock horror, who is not? It is one of the most common conversations in family medicine, and I've been there myself. I know what it takes, the discipline, the consistency. The slightly heartbreaking moment when you've been really good for 3 weeks and the scale does absolutely nothing. Humbling. Truly, truly humbling. Today, I want to talk about a device, not a drug, not an injection, not surgery, a capsule that you swallow that expands inside your stomach and then quietly, without any chemical activity, dissolves and leaves your body entirely. And here's what I want you to hold on to until the end. By the time we're done, I'm going to give you the exact list of who this is for and, just as importantly, who it is absolutely not for. One of those groups might genuinely surprise you, and I'll give you one question worth taking to your GP. So stay with me. Let me say something first that gets lost in the weight loss conversation because it so quickly becomes about appearance or willpower or shame. Weight is a medical issue. Managing it well reduces cardiovascular risk, improves metabolic health, reduces strain on your joints, improves your sleep, and lowers the risk of a number of cancers. The evidence for those benefits is robust. And yet, managing weight is genuinely hard, not because people are lazy, but because biology, environment, and psychology are all working against them simultaneously. The number of people who achieve significant sustained weight loss through lifestyle modification alone and keep it off is, the evidence tells us, a minority. Most people need more than a diet sheet, which brings me to the question I keep coming back to. The standard path now is lifestyle intervention. If that's not enough, consider a drug, specifically a GLP-1 or a combination with GIP. You probably know these as semaglutide, tirzepatide, Ozempic, Wegovy, Mounjaro, those are the brand names. But here's the question I think we're not asking loudly enough. What if the patient's decision not to take a drug is a clinical variable and not an obstacle? What if, for some patients, a non-drug option with real evidence is exactly the right tool? And that's what this video is about. I want to be clear about where I stand on the new medications because this video is not an attack on them. I prescribe them judiciously and very carefully. And I'll be doing a dedicated video on how I actually use them in my practice, the decisions I make, what I've observed, what the evidence shows. So watch out for that one, which will be coming soon. But here's the honest picture. Semaglutide, or Ozempic, was first approved for type 2 diabetes in 2017 and for obesity in 2021. Tirzepatide was approved for obesity in 2023. We are working with 9 years of follow-up data for semaglutide in diabetes and considerably less for obesity. And that's not nothing, and the emerging evidence is genuinely promising. But it's a ceiling. For most patients on these drugs today, we simply don't have data beyond that window. GLP-1s also have a real side effect profile: nausea, vomiting, gastrointestinal disturbances, which are particularly common, and they can happen very early on in treatment. And there are open questions about a loss of lean mass, lean muscle mass, longer-term thyroid and gallbladder data, which are also still emerging. And then there are patients who simply say, no, not for me. I don't want a drug in my system. And that's a very legitimate clinical position. And now there's something worth offering them. There's a device called Epitomee. It's a prescription device, so it needs to be prescribed by a doctor, cleared by the FDA, the Federal Drug Administration in America, in 2024. I have no financial relationship with the company, no sponsorship, no payment, nothing. I'm looking at this purely as a clinician. And here's the mechanism, and it is genuinely elegant. You swallow a capsule, it reaches your stomach. Your stomach is acidic, around a pH of 2. And the capsule's outer shell is designed to open in that very specific acidic environment. The capsule is a superabsorbent hydrogel polymer. Think of it like a dry sponge, except that this sponge can absorb up to 100 times of its own dry weight in water. And it expands into a 3-dimensional gel structure inside your stomach. And that structure takes up space, and that space mechanically signals fullness. You eat less, over time you lose weight. There is no chemical activity, it never enters your bloodstream, it has no systemic effect whatsoever. It does just one thing, it takes up space and causes a feeling of fullness. And then, and this is the part that I still find genuinely interesting, the gel shrinks as the ion concentration rises further down the gut, passes through the digestive system and is excreted. Your body hasn't absorbed it, it's just passed through and it's left. The protocol is 2 capsules per day. One 30 minutes before lunch and one 30 minutes before dinner, or your 2 largest meals. Each of these is swallowed with 2 full glasses of water. The water is part of the mechanism. The hydrogel needs the fluid to be absorbed and to create the structure. And alongside the device, the company funds 3 online sessions with a registered dietitian. The clinical thinking behind this is very sensible. The device is a tool, it's not a plan, and having someone help you understand how to eat alongside it, how to structure your meals, how to get the most from that fullness signal, that support really matters. And anyone who's ever done well at lunch and then completely lost the plot at 9 o'clock in the evening will understand why a dietitian in your corner is not a bad idea. Incidentally, during the clinical trial, participants were actually given 14 very brief, so 15-minute sessions each, face-to-face with a dietitian, and the commercial program offers 3 online, which are a bit longer, but less in total number. And it's worth knowing when you're comparing like-for-like trial conditions versus real-world use. Now, right, does it actually work? Well, the pivotal trial is called RESET. It's a randomized, double-blinded, placebo-controlled, with 279 participants in 9 centers across the United States over a period of 6 months. And here's what happened. 56% of people in the Epitomee group lost at least 5% of their total body weight. 27% lost at least 10%, and 11% lost more than 15%. There were no serious adverse trial effects, so the device didn't cause any major problems with the patients. The trial also identified something in a pre-specified early responder analysis. People who had lost at least 2% of their body weight by week 8 went on to lose an average of 9.3% of their total body weight by week 24. And in a longer follow-up at 48 weeks, that extended to 11.2%. Now, I want to make sure that 9% or 11.2% figure actually lands. If you weigh 100 kilos, you're losing roughly 10% of your body weight. That's 10 kilos. It's a significant amount of weight. And that changes how your joints feel, it changes your blood pressure, it changes your metabolic numbers, your sleep. And this is all for a device with no chemical activity, no systemic absorption, and no serious adverse effects reported in the trial. Now, that's a meaningful clinical result. No drug, no injection, no surgery, a capsule that dissolved. Here is what I have to be honest with you about. Those results are real, but on raw weight loss numbers, GLP-1s at maximum dose outperform the device, but they also come with side effects and some risks. In the Step 1 trial, semaglutide, which is Ozempic, produced an average weight loss of around 15% at 68 weeks. With tirzepatide in Surmount 1 trial, we're looking at 20 to 22% at 72 weeks. You should also say that the RESET trial was funded by the device manufacturer. That's standard practice in device trials at this stage, but it's something I want to say out loud. It's a quality flag worth being aware of. Independent replication will be important. Now, what about the long-term benefits of GLP-1s beyond weight loss? Because this is genuinely where the argument for them becomes compelling. Select trial, nearly 17,500 patients showed semaglutide reduced major cardiovascular events, heart attack, strokes, cardiovascular death. These are hard endpoints, not surrogate markers, and the magnitude surprised even cardiologists. For metabolic liver disease, MASH, which stands for metabolic dysfunction-associated steatohepatitis, a form of fatty liver disease, the ESSENCE trial showed semaglutide improved liver histology. Now, that's a surrogate marker. Not yet hard outcome data like liver failure or transplant rates, but it's an encouraging direction. Knee osteoarthritis, the Step 9 trial showed significant reduction with semaglutide, likely a combination of reduced joint load from weight loss and possibly other effects on the blood supply to the cartilage, which is really remarkable. And there are early signals, I want to be precise, preliminary large observational of possible protective effects even for certain types of cancers. But the cardiovascular data is strong and the cancer data is not yet in the same tier at all. Epitomee does not carry those downstream benefits as far as we know. That's an honest limitation and I'm not going to minimize it, though I will say that some of the most important benefits that we can obtain can come from diet. exercise, sleep and nutrition. This would be a very long video indeed if I were to stand here and give the exact balance of which is best for each person. This is a very individual thing and somewhat philosophical, but with very practical implications. But here's the thing, a patient who refuses a GLP-1 gains none of those benefits either. A 9 to 11% weight loss from a dissolving capsule for a patient who would otherwise do nothing, that is not nothing. Weight loss itself carries cardiovascular, metabolic and joint benefits regardless of the mechanism. So, who is Harold? Harold is the patient who has tried diet and exercise and hasn't gotten where he needs to be. When I say, let's talk about medication, he says no. Not because he doesn't understand the evidence, because he simply doesn't want a drug in his system. He's also the patient at a BMI of body mass index of 28, let's say, where the risk-benefit calculation for a systemic drug looks different than for someone with a BMI of 40 and 3 other illnesses surrounding it. And he is the patient who, when I explained that this device never enters his bloodstream, never has a chemical effect and will eventually pass through and be gone, visibly relaxes. And that reaction tells me something. Right. I promised you the list. Here it is. Who Epitomee is indicated for? Adults aged 18 and over with a BMI between 25 and 40, people who want a non-drug approach to weight management, people who've tried diet and exercise without achieving the results that they need, people who can't tolerate or simply don't want a drug-based treatment. It is a prescription device. You need a healthcare provider to prescribe it. Now, who should not use it? Not to use it if you're pregnant, or if you have a condition that causes narrowing of the intestine, such as Crohn's disease, where intestinal strictures may be present. Not if you've had gastrointestinal surgery with complications, obstruction, adhesions, adhesive peritonitis. Not if you have diverticulæ, which are outpouchings in the colon. Not if you have a swallowing difficulty. And not if you have a known allergy to the capsule components. And here is the group that I said might surprise you. If you have established cardiovascular disease, metabolic liver disease, or significant osteoarthritis, the downstream benefits of GLP-1s that I've described are clinically meaningful and real in that situation. Choosing a device in that situation over a drug because the device feels less daunting is a conversation worth having carefully with your doctor. Don't let the desire to avoid a drug mean you inadvertently miss out on protection that you genuinely need. This is not an either or, it's patient-matched medicine. And here's where I land. Epitomee is real. I've prescribed this to patients, but it's early days yet, so I will follow this up in a number of months to let you know more. The trial data is real. The FDA clearance is real. The right patient, someone who wants a non-drug option, whose BMI sits between 25 and 40, who doesn't have the contraindications I've listed. This is now a legitimate clinical option worth knowing about and worth discussing with your doctor. It is not a replacement for GLP-1s in patients where those drugs are genuinely indicated. It doesn't yet carry their breadth of downstream evidence. The main trial was industry funded and needs independent replication. But for Harold, and there are a lot of Harolds, it might be the thing that breaks a 20-year cycle. And as I said, I've been a bit Harold myself at times, and I know what it takes, the discipline, the consistency, the humbling scales, and I genuinely respect anyone who keeps at it. The question worth talking to your GP. This video has got you thinking, given where I am with my weight and given that I prefer not to use medication, is there a non-drug option with clinical trial data that might be right for me? And you can mention this device. I think it's a reasonable question. A good doctor will hopefully listen and try and enable the correct conversation and possibly a prescription. Now, if you found this useful, the single most helpful thing you can do is pass it on. Send it to one person you think could benefit. A family member, a colleague, a friend who's been on the same diet 3 times. You don't need to do anything else, just that. And if you'd like to stay part of this community, subscribe, come back. The GLP-1 video is coming, my own clinical approach, cases from the practice, things that I've had to rethink. I genuinely look forward to seeing you again. This is The Accidental Doctor, where we look at uncommon sense medicine. Stay healthy and stay very curious. Ciao for now.